over the past few days, I've been exploring a new and very interesting issue that perhaps people haven't paid enough attention to. So I'm talking about the massive snakebite crisis that's present in India currently. And to discuss that today, I have one of India's leading herpetologists, Sumanth Bindumadhav, along with me. Sumanth works with Humane Society International, and he has been trying to draw attention to the scale of this crisis over the past few years. Today, I'm happy that he's given us some time. Welcome, Sumanth.
Thanks, Vikhar. Thanks so much for having me here. And thank you more than that for speaking on this. It's so vital that we start talking more and more about this.
That's interesting, Suman, that you mentioned that this theme needs more attention.
Yes.
So I am aware, over the past few days I've been reading and trying to understand the scale of this crisis. Can you describe for our viewers, to our viewers, how massive is this crisis? When I first heard it described as a crisis, I was slightly skeptical. But then I went back and looked at some informal estimates that have been made, and according to which more than 50,000 people are dying in India because of snake bites annually.
Yes.
That is huge indeed. Perhaps, we need to think of another phrase to describe it going beyond a crisis. So, can you start by describing the scale of this issue?
True. I think it is definitely a crisis, and a crisis that we are yet to truly estimate the proportion of, and that's been the challenge. To start with, WHO has called snakebite a neglected tropical disease, and India is unfortunately the snakebite capital of the world. That should speak volumes to itself. But to put things in perspective, we have about 10 lakh snakebite cases every year in India. Out of these 10 lakh cases, we have about 58,000 deaths every year. To put it further into perspective, that's 6 deaths every hour from snakebite in India. And what's even more jarring is for every death that occurs, there's about 9 people who suffer from morbidity. That means they lose either their hands, their legs, some part of their body, because of which they're not able to go out and function like they used to otherwise. That truly is the crux of the problem. What we also know for a fact that it's not a urban disease, right? It's not something that affecting the affluent, unlike other diseases that are prevalent. This is purely affecting those who are farming or those who are day wage laborers. So the socioeconomic impact of snakebite is far, far higher than what is visible to the naked eye. Even when we say these numbers of 58,000 deaths, it may just seem like a figure out there. But when you start deep diving into the true cost of snakebite, it's beyond comprehension for us, honestly. Think about this. Where we work in Mysore, in Karnataka, in Mysore district, we had a person in our study site who was bitten by a snake. Before that, he was an ITI trained graduate working in a company, earning about 35,000 rupees a month and feeding a family of 7. He had an accidental encounter and he was bitten by a snake. He was out of job for 3 months. He was running between hospitals and various medical facilities. Ultimately, when he was okay to go back and work, he couldn't land the same job again. He ended up working in a hardware store for 10,000 rupees a month and still feeding a family of 7. It's impossible to have a conversation with him where he doesn't break down. And of course, it's understandable. 10,000 rupees today in rural India can't feed a family of 7. That's the true cost of snakebite, the opportunity cost. Everything jumbled up into otherwise what is just the hospital bill. That is the true cost of snakebite that we don't even begin to understand. We often look at how much did a snakebite cost, 1 lakh rupees. We think it's done, but there's so much more to it than meets the eye. And just the mental health trauma of people. For the first time ever, we did a study with 27 individuals who've been bitten by snakes in Mysore region to understand the mental health impact of snakebite. And those results are scary to say the least, and it's truly jarring. There were people in our study who were bitten 25, 27 years ago who still physically shiver when they see a pile of leaves. That's the kind of trauma that nobody needs to live with. And the unfortunate thing is the result of all of this trauma is hatred towards snakes and fear of snakes. If you go to rural India, and when you went there as well, you will find everybody who knows somebody who's been bitten by a snake. Invariably, they have an innate fear of snakes or hatred towards snakes, depending on how close they are to the victim themselves. The bottom line is that the minute snakes are seen, they are killed on sight or they are caught and relocated, which also results in their death. And it doesn't solve conflict. In India, we're a tropical country, there's never going to be a day when humans and snakes will not be sharing space. So it's important for us to understand the true magnitude of this problem in all senses and then try and figure out how do we address it regionally and systemically. So again, the priority needs to be safeguarding people's lives and livelihoods. Snakes are going to be protected by themselves as there are lesser and lesser people dying from snake bite. The true scale of it, like you said, it's a crisis that no one's paid attention to. And I feel
So,
like it's simply because it's the poorest sections of the society getting bitten by snakes and it's not affecting the rich.
okay.
Their voices are subdued.
So, if I could ask you, you've described the scale of the problem very well, but how did you arrive at this figure of 10 lakh snake bites, 58,000 deaths annually, 6 deaths per hour?
Right.
I'm curious. I mean, if these numbers that you've provided are even roughly accurate,
Right.
roughly close to the truth, that would mean that the number of victims due to snake bites are more than the rest of the victims due to all other human animal conflicts in the country. Would I be right when I say that?
You're very, very right. In fact, the number of people who die from snakebite is significantly higher than the number of people who die from conflict with elephants, tigers, leopards, crocodiles, and bears combined. The scale is massive, and these numbers come to us thanks to something called the Million Death Study that was done first in 2009-10 and repeated again in 2019-20. It was a door-to-door survey done and then extrapolated to the rest of the country to give us these numbers. Very realistically, these are still underestimates. These are still lower estimates than what it really is. Because if you look at 10 lakh bites that occur every year, in the place that we work alone, in a 5-6 kilometer radius within our project site, we found about 30 snake bite victims who've been bitten in the last 2 years. That's in a 5 square kilometer that comprising maybe of 5 villages or 6 villages.
30 snake bite victims and how many deaths?
30 snake bite victims and 4 deaths.
Okay.
Again, with snake bite, the bigger concern is the morbidity that it causes and all the after effects of it. As harsh as it may sound, the morbidity that's caused from snake bite is far, far worse. We've seen people who've lost a leg, who've lost a few digits on their hands, are never able to go back and work like they used to. And again, like I said, if they can't go and farm in their own fields or if they can't go and work where they used to, the effect of it, the financial burden of it is passed on to the family. We've seen women having to go out and work in the field, children sometimes being pulled out of school and being sent to work in the field just to pay off the debt or just to make up for what a male member of the family would earn. So these to us, all of these puts into perspective, right? And as a herpetologist and people who like snakes, we're coming from the point of view of wanting to conserve snakes and not have them be killed in conflict. It's impossible to do that for as long as people are dying from snake bite. There's no way with all sensitivity we can go to a rural community and say, you have 4 deaths occurring here every year. It's okay, but still be okay with snakes around you. So we can't, it's not a conversation to be had until we solve this. And we're extremely thankful to the Million Death Study that was done by the University of Toronto and the Registrar General of India to put these figures forward to us. Otherwise, the official health data figures speak about 2,500 deaths a year, which is so far removed from what it really is.
In India?
In India, yes.
Okay.
And that's again because 80% of snakebite victims don't even go to a hospital or any medical facility. Yeah. Because there's so many superstitions and myths attached to snakes and snake bite, they often end up going to a convent or a local healer. So the true number is never captured until you do a door-to-door survey like what the Million Death Study did. And these numbers are staggering. While it is staggering, it may still be gross underreporting because the reality could be far, far higher. And we have no idea of this yet at this point.
It's just shocking, Sumanth, when to listen to you, because the problem is so huge, so pervasive, but completely ignored, completely marginalized. So, which brings me to my next question. I've reported on instances of human wildlife conflict. It's usually localized, uh, dependent, and pertains to a particular species,
Right.
right? Uh, and even then, it's incredibly complex. I'm talking about some of my reportage on human elephant conflict in the hills of Hassan,
Right.
or large carnivore conflict with livestock and humans on the fringes of Nagarhole and Bandipur. So these are some things that I've reported on, and that itself is hugely complex, right? But when it comes to mitigating something like snake human conflict,
Right.
I commonsensically, when I think about it, I can't even imagine where you would begin, right? Because there is no protected area where you can push the snakes back. So they're slithering all over.
Yes.
So farmers go into the agricultural fields, they have to go there, and unfortunately some of them will be bitten,
Yes.
right? So I feel it's just, is this one of the reasons why people haven't paid enough attention to it, because it's just so complicated. It's an imbroglio, right? In a way, how do you resolve it? So when you work in terms of mitigating this conflict, how do you go about it? Where do you even start?
Well, you're right in saying, in addressing the complexity of it, it's very, very daunting, which is also why we have so few people working at the crux of humans and snakes. There are a lot of scientists who are working on taxonomy and constantly describing new species of snakes, which is good and bad because it also means we have more snakes to deal with now. But the crux of human snake conflict is extremely complex. Like you said, and sometimes we keep joking amongst all the other biologists that elephants and tigers and leopards are probably easier because you're only dealing with two-dimensional or three-dimensional factors of conflict itself. With snakebite, the complexity begins with the snake itself. What we realized a few years ago is that the venom of snakes varies across region, even within the same species, which means a Russell's viper in Karnataka could potentially have different venom from a Russell's viper in Madhya Pradesh, for instance. Why that's a problem is because all the antivenom, which is the only medicine we have for snakebite treatment, is made from venom of snakes only in Tamil Nadu, which means it doesn't work as well when it's administered to a victim in West Bengal, for instance, or some other state. So, for us to understand how venom varies within the same species and why it varies is going to be crucial to even create a better antivenom. Right now, there's several challenges with the antivenom itself. Like I said, the venom is one part of it, but there's also the other factor that venom is there's no quality control around venom from the government side, which is a big gap in policy. Some batches of antivenom are good, some are bad. There's no consistency and standards in it, which means if I go to a hospital today as a snakebite victim, I don't know the efficacy of the antivenom that I'm going to be given, which causes a big problem, right? It also erodes people's faith in medical setup if they go to a hospital and aren't cured from snakebite, which is otherwise a completely curable disease. So that's the problem with antivenom, and that's something that we have to deal with and figure out how do we get representation from multiple states going into the antivenom that's ultimately coming out to make it more effective. Also, the antivenom that we have at the moment is only for 4 species of snakes. That's the spectacled cobra, the Russell's viper, the saw-scale viper, and the common krait. What this does is that we have 18 other species in the country which are medically significant, which can cause mortality or morbidity, and we don't have antivenom for those species. We also don't have antivenom for any of the venomous species in northeast India at this point of time. That's a big concern. It's ignoring a big population, it's ignoring 7 states, and we don't have antivenom for any of those. So there are multiple challenges, and unlike with elephants or tigers or leopards, you're dealing with the forest department as one entity and communities as another. Here, it's a problem of the forest department, the health department, the rural development and panchayat raj, department of agriculture. We have to liaise between so many government agencies to come together and cohesively work towards the solution, which is a challenge in itself, which is a bigger challenge. And then we have to work on the snake side of it, understanding their ecology, and also work with communities and say, why is it okay to be around snakes, and how do you keep yourself safe when you're coexisting with snakes? So,
So, what are some very simple ways in which someone could protect themselves? Increase vigilance, perhaps,
right.
but you can't expect a farmer who's working hard through the day in a field to pay attention to where a snake is coming from. So, what are some simple mechanisms by which, say, a farmer working on his field could safeguard himself?
True, and we've actually looked at quite a few instances of bites and trying to understand how these bites occur and why they occur. What we've also noticed is that most of them occur at night when people are walking without a flashlight, and the predominant thought is, I'm just going to go to my field, turn on the motor, and come back. This is a walk I make every night. Why do I need to be more cautious tonight than any other night? So they throw caution to the wind and they don't use a flashlight or don't use footwear. And it only needs that one day when an accident has to happen. That's where most people falter, most farmers falter especially. So what we advise is always carry flashlight after dark. You need to know where you're stepping. Wear footwear, closed footwear if possible. It's challenging when you're working in a field because you can't wear closed footwear, but at least at night. We also advise that if you're stepping in or putting your hand into a place where you can't see, for example, under a pile of hay, you always use a stick, move it around first, disturb whatever is there potentially, then proceed to pick it up with your hands. These are some of the things that we often caution farmers on. We also advise them to say that if you're sleeping on the floor at night, use a mosquito net that's hanging from the top of your bed and tuck it under your mattress. That prevents crates which have been known to cozy up next to people who are sleeping on the floor, unfortunately. So that can prevent a snake bite, and that costs 150 rupees. If that can save a life, it's truly well worth it.
Okay. And you mentioned the big four. Do you have any sense? You've been working on this issue for a few years. Do you have any sense of what percentage of snake bites are caused by the big four?
We don't,
Roughly.
yeah, at this point, we don't have accurate numbers on those. We do know that they are responsible for most of the bites because these are also species that are what are called commensal species, which means they're attached themselves to human populations the most. We as humans are very filthy, as you must have observed. We have garbage around us everywhere we go. Rodents come to those, and these four snakes are the ones who are most drawn to these rodents that are around human habitation. So they are the most commonly occurring venomous snakes. Increasingly, we are trying to move away from the terminology of Big Four. To introduce the term Big Four, when it was introduced, it served a humongous purpose of drawing first attention to this topic itself, because it's a catchy thing to say Big Four and this is what needs attention. Now, as we've known more, as science has evolved more, we know that, like I said, there are 18 species totally which are medically significant. So we need to broaden our horizon and keep it to medically significant snakes. The more and more we say Big Four, the more and more our solutions are going to be focused only towards these four species. Again, isolating a large number of places where these aren't found at all. So we are increasingly moving to saying medically significant snakes.
One thing that came up during our conversation is the lack of data.
Yes.
And the
Death
million death study was a pioneering move to tabulate, to make an estimate, even though it's still, I'm sure, like you said, it's underreported.
Yes.
So, coming to an important decision that the Karnataka government took earlier this year in February to make snakebite a notifiable disease.
Correct.
You had a role to play in this to bring awareness to the Department of Health. I think you were at it tenaciously from the past few years. Uh, Thank you for that. Partly as a result of that, now Karnataka took this decision. Novel decision. I think it's the first state, if I'm correct, in India to do that. So simply it means that all snake bites need to be reported to the district health authorities, and this will generate data subsequently which will help you, people like you and people involved in the health department in the government of Karnataka, to come up with remedial measures. So are you happy that this has finally happened, and what are some of the other implications of this?
No, this was a big first step for us, honestly, because Karnataka has sort of been at the forefront of trying to solve this issue of snakebite. In many ways, the forest department all these years has been incredibly supportive of research on snakebite ecology, snake ecology itself. What we also realized, like I said, it's a public health problem and not so much of a forest department issue itself. So when we started working with the health department, we've been incredibly fortunate to have such good officers in key decision making places, and they lapped it up, and they the openness that they had to listen to this information that we were saying, and to say that this needs to be done for the betterment of people. That's where it all began. And I think the key to advocating any policy reform is wait in their office till they get tired of seeing you, and then they do what needs to be done. But we're so thankful to the Department of Health and Family Welfare, Government of Karnataka, for actually making it a notifiable disease and being the first in the country to do so. What this means is that any snakebite case that's reported to either a government or a private facility has to now be reported on a common platform. Every hospital has a login and password to this, the integrated health information portal. They have to log in and report it. What this does is it starts filling in the very basic information gap that we have on the number of snake bites occurring in different districts. This has only been a few months, like you said, it's only been February. From February to now, we already have data that's coming in that's hitherto unknown. We've been seeing in Karnataka, for instance, that there's a high instances of bites in Chikbalapur in August, and we don't know why that is. This gives us information to actually figure out and say why are these things even happening, or where do interventions need to be focused. At this point we are going by this million death study, which gives us state-wise figures, but is really hard for us as working in Karnataka to devise interventions that are specific to a location that's high burden. Now, with this coming in and over the next couple of years, we'll have such invaluable data to actually identify high burden districts, the times of it, the patterns of it, and if we notice, for instance, that snake bites are more in August, we could very well look at July and say what can we do in July in this high burden district to avoid these snake bites from occurring in the first place. The notification of it is so key. It gives us so much information on these bites occurring themselves. Can we correlate it with rainfall? Can we correlate it with agricultural patterns? There's so many possibilities that we can then look at and see how we can prevent it. Because for us, like as it is for any other disease, prevention is way better than cure, especially in snakebite. And huge tip of the hat to Karnataka government for doing this. And we're hoping that other states emulate and follow suit. We'll have such robust data coming in with all of this as well.
One last question, Sumant. So, all this is still contingent upon people going and reporting,
Yes.
right? My field excursion showed, and your engagement, your deep engagement with the issue clearly shows that a lot of them don't go to the hospital. They're going to local healers
Yes.
who have a reputation, supposed reputation to treating victims. So, how do you go about changing attitudes of people?
That's the challenge, honestly, and I think it's two reasons. One is, in the past, when people have gone to hospitals, they've been turned away from treatment or have not been given the right treatment. Again, it comes back to snakes. When snakes bite people, they don't always release or inject venom. There's a good chance that when snakes bite 10 times, there are 8 instances when they don't release any venom, what's called a dry bite, or there's very minute quantities of venom. So in those instances, there is of course a lot of panic and hysteria in case of a snake bite. People go to a local healer, they will say eat chilies and don't sleep all night and all of these. They put a black stone over the site of bite. Because there's no venom in the body to begin with, as time passes they become completely fine because there's no venom, and then that keeps reinforcing people's faith in local healers. In the rare instances when there is venom and a local healer or a convent is not able to do anything and they go to a hospital, it's already too late and the person ends up losing a limb or their life. And that erodes the faith in medical setup, unfortunately. So our key effort is on two fronts. One is to build the capacity of the medical and the health department to not turn away patients and to give them the treatment they deserve. For us to then go and confidently tell people that if you get bitten by a snake, go straight to a hospital. There is nothing else that you need to do. What would be truly tragic is if we drive people to hospitals and they still don't get care there. That again further erodes people's trust in the government setup. So for us, it's a two-pronged approach where we are working to build capacity of the health department as well, and then driving people to hospitals. So I'd like to stay optimistic, and I think the one way of changing people's attitude is to work with the younger generation that's coming in now. So we do a lot of engagement programs with schools and communities, teaching them to identify the four venomous snakes that they see around them. How do you avoid snake bite, and what's the right snake bite management protocol in house? With these, I have a lot of faith in the next generation that they will change, and they will take this message back home as well. So yeah, and I remain optimistic as ever.
It was great having this conversation with you, Suman. Very revelatory. I learnt a lot of things today, and hopefully, intervention of a herpetologist like you. And now that the governments have taken cognizance of this, we will devise more fruitful methods of abating deaths and morbidity due to snake bite. Thank you, Suman.